What is a PET CT scan? So PET CT scan is two separate scans done by the same machine. So the PET scan, positron emission tomography, as the name suggests, is a scanning device, a type of scan that picks up positron emission. So positron is like a positive twin of an electron, and they are emitted in your body when you have a radioactive dye in your body. So the positron emission tomography, you get injected with sugar that's had one of the atoms in the sugar molecule, the glucose molecule, replaced by a very mildly radioactive fluorine atom. And then you lie down and wait like an hour or 90 minutes, and the sugar is transported around your body and builds up in organs that are working hard and in cancer cells. And then this can be seen on the machine. A PET scan machine is incredibly expensive, and it makes sense to combine it with a CT scanner, which is CT is a computed tomography, and it's essentially just a series of X-rays, so lots and lots and lots of X-rays. And another reason for to have the same machine doing these two scans is that then you can get three images, or essentially three sets of images, really. So you get the PET images, which will have glowing areas where organs are working hard, and if there's cancer present, then you should see glowing areas where the cancer is. These are they talk about like the uptake of the radioactive dye. So the radioactive dye is called FDG, and there are avid regions where there's increased uptake. So that's the kind of language that the radiographers will use, and your oncologist might use. And then you have the CT image as well, which is loads and loads and loads of X-ray slices. So X-rays taken maybe every 5 millimeters or every 4 millimeters. And then the fused image where they're both combined. And using these three sets of images can be really helpful, because you may have a tumor that doesn't show on the PET scan but is visible on the CT part. The PET scan is very useful because it can show if an organ is working very hard. Something that may look like a tumor on the CT part of the scan, when you look at it on the PET scan, you may see that it's not really a tumor. It could be a dead cancer tumor. It could be some tissue damage or something. So having this three sets of images of the body is really, really useful. It's not like a question of one scan being better than another. Different scans are appropriate for different things. An MRI scan, for example, often used with the liver, they can be really high resolution, and with a skilled radiographer, the radiographer could see really small areas of cancer, and yeah, different scans have different purposes, and multiple scans are really good. So that's what a PET CT scan is.